Welcome to the latest edition of Rare Diseases Updates, covering recent breakthroughs in the field, brought to you by Lucid Quest. First, Health Canada approved Elfabrio peguniglycidase alpha enzyme replacement therapy for adults with Fabry disease. Prior approvals exist in the United States, European Union, and United Kingdom, supported by Phase 3 Bridge, Balance and Bright, with more than 140 participants. Regulators deemed it safe and effective, offering another ERT option that could shape pricing and formulary access. Next, the FDA issued a complete response letter for Corcept's relacorilant for hypertension due to hypercortisolism. The agency requested additional efficacy evidence. GRACE met its blood pressure endpoint, while Gradient missed its primary endpoint but showed secondary benefits. Corcept will discuss next steps with the FDA, and prescriber and payer decisions may pause pending full data. In Europe, Sanofi's Wayrilz, rilzabrutinib, gained approval for adult immune thrombocytopenia. This oral, reversible BTK inhibitor achieved primary and secondary endpoints in LUNA-3, with durable platelet responses and quality of life improvements. It is the first BTK inhibitor approved for ITP in the EU, with expedited and orphan designations noted across regions, which may influence treatment selection and reimbursement. Pfizer reported a fatal thrombotic stroke in an open-label extension study of Hympavzi in haemophilia A with inhibitors after minor surgery. Causality is under investigation by the sponsor and the Independent Data Monitoring Committee, and regulators have been notified. Pfizer does not anticipate a change to the safety profile for approved uses, though the event may factor into clinical and payer discussions. The FDA issued a complete response letter for Atara's tabelecleucel in EBV-positive post-transplant lymphoproliferative disorder, stating the allele study is not adequate for accelerated approval due to interpretability concerns related to design, conduct, and analysis. The company notes this differs from prior guidance. Ebvallo remains approved in the EU. Palvella outlined 2026 milestones for the Q-Taurin platform. The Phase 3 SELVA study in microcystic lymphatic malformations is fully enrolled at 51 participants, with top-line data expected in March 2026 and a potential NDA in the second half of 2026 if positive. After a positive Phase 2 in cutaneous venous malformations, FDA interactions are planned in the first quarter of 2026, and additional Phase 2 studies are slated for the second half. Agios set 2026 priorities. AQVESME mitapivat received US approval in December 2025 for anemia in alpha or beta thalassemia, with REMS implementation and launch underway. A pre-supplemental NDA meeting for sickle cell disease is planned for the first quarter of 2026, and multiple 2026 readouts are expected for tebapivat and AG236, which could guide broader portfolio growth. Finally, the FDA approved ZYCUBO copper histidinate, the first US therapy for pediatric Menkes disease. The decision, which includes breakthrough, fast-track, rare pediatric disease, and orphan designations, was supported by a survival benefit versus an external contemporaneous control. The label notes common systemic and infection-related adverse events. This milestone may reset payer expectations and access pathways in Menkes disease. Stay ahead in rare diseases research. Like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com.